Welcome to Ritter Cares. I'm Michael McConnell, and I'm a reference associate here at the Ritter Public Library. In this installment of the Ritter Cares series, we will be speaking with Elizabeth Lang, and she is the wellness coordinator at Kingston in Vermilion. Kingston operates senior living and rehabilitation services in several states throughout the country. Here in Vermilion, there are 2 Kingston facilities providing senior living and rehab services. Today, we'll be discussing some of the fundamentals of maintaining an active lifestyle. At any age, the benefits of regular exercise are countless. It can lead to better brain, heart, and bone health, reduce anxiety, and can help prevent many common diseases. And as we get older, staying active is crucial in preserving the ability to live independently. So Elizabeth, you want to tell us a little bit about yourself, and then we can discuss some of the ways our patrons can maintain an active lifestyle?
Sure. So like you said, I am the wellness coordinator over at Kingston of Vermilion. I've actually been helping out over at the Kingston Residence Building, which is the assisted living, just while all this COVID stuff has been going on. But I'm excited to get back to my job eventually. And so I teach water aerobics classes over there. And then I also do wellness training, which is like one-on-one training. That can either be with people, the residents inside of the facility, or it can be for anybody in the community that wants to come in and get personal training, essentially. I do have a degree in exercise science. I went to the University of Akron. And then I also am a certified personal trainer through the National Academy of Sports Medicine.
Oh, okay, cool. Well, then we'll start discussing the topic then. So many people will obviously start an exercise routine and stop after a few weeks. How can we develop the long-term habit of exercising?
So that's a great question, and probably one of the biggest questions I get a lot, because it is really hard to start an exercise routine and maintain it. Typically, a habit is going to take about 2 months to develop and become routine. So one of my recommendations is make sure you have a game plan when you are starting an exercise routine. Know what time of day you're going to do it, how many days a week do you want to do it. Really take a step back and look at your schedule, know what you can afford to incorporate into your day-to-day routine. Don't wing it, because I think that's what a lot of people do. You know, they get excited for the new year, start a New Year's resolution, and they don't really have a game plan, or really even a solid goal that they want to achieve. It's just, you know, I want to lose weight, or I just want to become more active. But you definitely want to know what your goals are, and you want to start small so that along the way, you can see little achievements that are taking place. I think that's going to motivate people. Another thing is you want to be flexible. And I just feel like a lot of times when people have big goals and they can't accomplish it right away, they get discouraged. And then that's kind of when it just kind of goes on the back burner. So just make sure that you're flexible. Know that you can start an exercise routine and maybe it's not going to work out, and that's okay. Be willing to modify it to fit your lifestyle. You know, there isn't a one size fits all with exercise. You kind of have to do a trial and error to see what's going to work. Another good way too is to know the why of what you're doing. And like I said, a lot of people will just say, well, I want to lose weight. But try and dig deeper to figure out, why do you want to lose weight? What is your long-term goal with that and your motivation? Because I really think that's going to give you the fire that you need to complete your goal. And then having an accountability partner, if you have somebody that you can exercise with, or just somebody that you can check in with. This can be a good and a bad thing, because if you pick somebody who ultimately isn't as motivated as you, they might actually end up bringing you down or preventing you from accomplishing your goal. So you just want to make sure you choose wisely and that you guys are on the same page. And then lastly, I would say you want to enjoy what you're doing. So I feel like a lot of people look at exercise as like, oh, I have to exercise. But one, and this was actually something I learned a couple months ago, I heard somebody talking about it, but rather than saying you have to work out, tell yourself you get to work out. It's a privilege to be able to move your body. It's a privilege to be able to say you can go to the gym or go for a walk, because a lot of people don't even share that luxury. So understanding it's a privilege to be able to move your body. It's something you get to do. And also just being able to enjoy it. If you aren't somebody who enjoys running, then maybe don't choose to do run as your cardio. You know, you get to choose and allow it to be something. Right. Yeah, exactly. Definitely choosing something that you're passionate about, or just something that you enjoy doing recreationally. You can turn that into a way to be active.
Cool. So for people that are just starting out, how often would you recommend them to exercise?
So typically they recommend 150 minutes a week, which
Mhm.
comes out to be about 30 minutes, 5 days a week. For somebody that's just starting out, that probably seems like a lot. So I would say at minimum, if you're just starting out, maybe try about 3 days a week and
Mhm.
then kind of work your way up. Um, I think one of the biggest reasons people don't exercise is because they say they don't have time,
Mhm.
which kind of goes back to my last question that I answered. Just really making sure you map out your day and think, okay, do I spend 30 minutes watching TV? Most of us probably spend hours watching TV every week. So if you can just carve out 30 minutes of your day to get that activity in between 3 and 5 days a week.
Mhm. And then should people be steadily increasing their exercise activity, especially for people that are just starting out exercising or just restarting out exercising? Like maybe during the pandemic, they, weren't able to go to the gym, so they stopped exercising as much.
Yeah. Definitely. I think it's more about intensity.
Hmm.
So say you want to start dedicating 5 days a week to exercise
Hmm.
for 30 minutes. That's fine, even if you're a beginner. You just want to make sure that what you're starting with isn't, I'm going to go for a 3 mile jog every
Yeah.
single
Hmm.
day, because that's going to be a lot on your body. You need to allow your body to adapt. So you want to
Hmm.
start small. And then when you do start an exercise routine, one thing that I encourage people to do is keep a set amount of intensity for at least 4 to 6 weeks. And then after that 4 to 6 weeks, then start to bump it up because
Okay.
you've given your body the enough time to adapt.
Hmm.
And then you can kind of start to bump up the intensity.
Okay. Um, Obviously, one issue is that pandemic has made it difficult to find exercise equipment in general. And again, now it's the new year, so it's going to be even harder.
Yeah.
So are there, you know, can people use household equipment as weights? What type of cardio workouts can people do at home?
Yes. So one of the things that I love that I want everybody to go out and get is resistance bands. You can get those at Walmart. You can even get them at Aldi. I've seen them at Aldi. Target, you can find them anywhere, and they're
Mm-hmm.
really inexpensive and they're awesome. And it's something that doesn't take up a lot of space in your house. I keep mine. We have like a little like coffee table that pulls up, and I just stick it under there. Easy to store, and you can get all sorts of resistance, like in terms of the difficulty,
Mm-hmm.
which are usually in different colors. And there's just so many things you can do with them, and they're really easy to use. It makes working out at home easier because you don't have to have all those weights sitting around. So I'd say definitely using resistance bands. You can also buy things like a physio ball if you want to invest in that. You can get those at Dick's Sporting Goods.
Mm-hmm.
But otherwise, I mean, there's just a ton of things you can do just with body weight. You don't have to have weights. I think a lot of people have the misconception that you can't build muscle if you're not lifting weight.
Mm-hmm.
And that's not true. Your body weight exercises can and will build muscle if you do them for the correct amount of time. So I think my go-tos probably, and there are so many, so I've obviously left some out, but these are just a few. Push-ups are great, and these are all of these exercises can be modified. So I know sometimes push-ups can seem intimidating, but you can definitely modify them.
Mm-hmm.
Squats are great, lunges, calf raises, planks. Really any abdominal exercise is body weight typically.
Mm-hmm.
So there's an endless amount of abdominal exercises that you can do. Step ups are really good. You can use your stairs for that. Jumping jacks,
Mm-hmm.
jumping rope in place, jogging in place, even just going for a walk, maybe if there's a random nice day in Ohio. So yeah, there's just endless amounts of ways that you can exercise without equipment.
Yeah. And then weight training specifically, I mean, obviously it's important at all ages, but it can be really important for our older patrons, right?
Mm-hmm. Yep, definitely. And weight training, I would say typically about 2 days a week at minimum, you want to try
Mm-hmm.
and weight train. And like I said, with not having weights, that's where resistance bands are really
Mm-hmm.
great because the added resistance does mimic basically having like a dumbbell.
Mm-hmm.
If you don't have resistance bands, you can also use cans of soup, which I know people are like, what? But a can of soup is typically like a pound, usually about 10 ounces. So definitely can use that for a bunch of different things, bicep curls and stuff like
Mm-hmm.
that.
Cool. Um, So are there any safety considerations to consider, especially for people that are just starting out exercising?
Yes. So I think the main thing is just don't overdo it. So just make sure your goal is realistic and it fits with your fitness level that you're starting out with.
Mm-hmm.
I think a lot of people just have these huge goals, which is
Yeah.
great, but then they just go in too quickly and too fast and too much weight, and then that's when you get injured.
Mm-hmm.
So start off slow, allow your body to adapt. Do not compare yourself to others because it's really hard to do, especially in a gym setting. So I feel like it might be a little easier when you're at home by yourself if you're working out, but just know that everybody's body is different. Everybody adapts differently. So it's nothing to be ashamed of. Just start slow. I'd rather you start really easy and then work your way up versus trying to push yourself and then you end up getting injured. And then that actually can set you back even further because you could be out for 4 to 6 weeks with an injury. Stretching is huge. I would say definitely incorporate stretching into your exercise routine. You want to stretch before a workout and after.
Okay.
And just listen to your body. If you notice that a particular exercise that you're doing, like say if you're doing jumping at home for cardio and you notice your knees are starting to hurt, maybe think of something else or a way to modify it. You just have to listen, and you don't want to keep doing a move that's causing you joint discomfort.
Can that joint discomfort kind of go away as you progress exercising? So like if you start off running and you get knee pain and then you revert back to walking, can that kind of alleviate some of it, or?
It can. So one thing to keep in mind is I think when people start working out, typically if you've taken time away from working out and you just start up again, you're going to get something called DOMS, which is delayed onset muscle soreness. People sometimes mistake that for like, oh, I'm injured, my body really hurts, I'm sore, like I should probably stop. And DOMS is very common. It happens to everybody. So that will go away with time. So DOMS will slowly, you'll notice that as you work out more, you won't be as sore. So you do have to let that work itself out. That's where stretching comes in. Really key is when you start to get the soreness, you want to stretch your muscles out. That'll help it not be as severe. With joint pain, I mean, really anything you're doing, if you're noticing it's causing joint pain, it could really be like a form issue. Your form might be wrong. It could be like an alignment issue. So I would say if after a couple days you notice it's fine and you can work through it, okay. If it's something that doesn't go away and it actually is getting worse or even just staying the same and it's just not going away, I think that's when you need to listen to your body and understand, okay, maybe I need to choose something else. Or maybe you even need to consult a doctor just to see like if something more is going on.
Yeah. Okay. And then, for our older patrons, some of them may worry about falling while exercising. Do you have any recommendations for that?
Yes. So I would say always having something that you can hold on to, especially if you are used to using like an assisted device when you walk. If you're going to do a workout, you want to just make sure you have a banister to hold on to or a railing or a chair even, or having somebody present with you just to keep an eye on you. One thing I love about the water aerobics class, which I know we can't do right now, but if in the future it opens back up, working out in a pool is great, especially for people who have balance issues because the water is so buoyant. It just makes people feel a lot safer. And because the water is shallow, you don't have the fear of, slipping and falling and drowning or whatever. So it's really nice. It's easy on the joints. So that's one reason I love it. And I love it for people who do struggle with balance or even just like walking with an assisted device. But otherwise I would say definitely if you're at home, just make sure you have something to hold on to. You can also get a really good workout even seated in a chair. I've taught seated exercise and I actually do it here at the assisted living. And there's a lot of things that you can do seated. So even if you don't feel comfortable exercise standing up, that's totally fine. Really, we're just concerned about getting your heart rate up a little bit and moving your body. So you can do that seated and there's, a lot of different things that you can do seated.
All right. Well, great. Thank you for all this information.
Yeah.
I'm sure it'll be very helpful for our patrons. So
yes, I hope so.
Thank you for taking the time to speak with us.
Yeah, absolutely.